So today we're going to talk about emerging technologies for better and how they can be used for better patient outcomes. We're going to go over what we're talking about when we're saying emerging technology. We're going to talk about patient preferences, and most importantly, we're going to talk about how to overcome resistance to the embracing of emergency technologies and how to get those patients really engaged with what is coming for the future to improve their experiences in healthcare. And then we'll end with just some takeaways that we need to reinforce with our patients. So when we talk about emerging technologies, we're talking about artificial intelligence, virtual reality, and Internet of Things. In the Carroll's article in 2020, when the World Health Organization declared the year of the nurse and midwife, it was really used as a springboard to break down the barriers and really have the nursing profession embrace these technologies. It was shown that they both improve optimization of nursing care and they enhance the patient experience in challenging situations such as rural settings. Then we went into Alexander in 2021, really looked at how do we have patients embrace the technology? What are the barriers that they face? What do they want to see in the use of technology? They've looked at patient preference, how they use it at home, how they like to use it. We want to make sure that one thing they found is that you need to have robust variety of options for these patients to engage with the technology. And most importantly, you need to build trust with the patients so that they understand that their data is secure, that this is just to enhance their care. We're not replacing their physician. We're just trying to make it better experience for them. They found that also an interesting fact that they found is that the more serious condition that a patient had, it was more likely that they were to embrace the technology use because they were more concerned with their care. So really, the biggest thing is we need to work on overcoming resistance. So I have a couple plans here on how we're going to bridge that gap to overcome that resistance. We're going to develop a promotional campaign that is really focused on the enhancement of care. We want to demonstrate that it is to better their patient experience, their care experience. We want to then also assure their privacy and security of their health information. We want to make sure they understand that this is not going out to a third-party vendor who's then going to sell it, and then their data is not going to be secure. And then most importantly, also part of the promotional campaign is we need to ensure that they understand we're not replacing the personal human care that they receive. We're not taking their doctor and replacing with AI. We're just enhancing how them and their healthcare team interacts with each other. Step 2, we want to develop this interface. It needs to be intuitive and easy for navigation. I propose using things like voice recognition with AI. We need to have multiple ways of communication. We want to use AI. I see us using AI with voice recognition so that users are able to just speak into the interface, not have to type out potentially on a phone all of their information that they want to get conveyed. We need to ensure that we're using multiple ways of communication. We want to develop with multiple languages so that our Spanish-speaking population can use their native language to interact with the interface. I also foresee that we should incorporate a readback for our visually impaired. Sometimes they're using a smaller phone. They don't have the latest, greatest technology. Often they're not going to be using desktops. I see enabling them to have voice readback so that they can get the information without having to use magnifying glasses or anything. Gradually, we're going to introduce Internet of Things so that their experience, their healthcare team gets up-to-date data We want to gradually begin basic with the applications that they're introduced to. Just basic interfaces, asking questions, setting up appointments, progress to more advanced things, integrate Internet of Things such as cardiac harnesses so that they don't have to wear it for a few days, then come back, then get the information downloaded. It's just automatically interacting, downloading into their patient records so that their healthcare team can immediately see those results. Glucose monitoring, encouraging daily, multiple times a day, them getting their glucose monitoring done. It's downloaded straight into their file. They don't have to then get the reading, enter it in, hope their healthcare provider sees it. It just automatically happens. Blood pressure monitoring, so many things that we can incorporate that they need to go home with, that then they just do what they use the device, it does what it needs to, and sends the information to the appropriate people. When we're introducing these devices, we need to ensure wide compatibility across multiple platforms so that they're not limited to just, oh, you have to use this device with this receiver. We want to ensure that we have lots of compatibility so that they're not having to get very specific, potentially expensive devices over and over and over. One of the fourth step, we want to really educate and make our healthcare teams, all of them engaged with the patient, subject matter experts on this technology. Ensure they're well-versed. Ensure they know the ins and outs. They are our best advocates for this technology. They can promote the benefits. They can show that you're going to get the information from your healthcare provider faster, better, and what you need in a timely fashion. We want to also make them to where they're able to say, you're not quite their patients aren't quite understanding one aspect of the interface. They're able to go in and show them, okay, here's what you do to get through these. Making healthcare team, the people they already trust, part of the advocacy group will make this so much more successful. A big thing that we want to also do is education. We want to involve not only the patient themselves, we want to bring their support system in, a caregiver, their friend, their family, bring them in to aid in learning this technology so that they can provide comfort and help them if they're struggling with it. We can also use VR as part of the education system. Patients often don't feel comfortable with procedures they're going to be receiving. We want to use potentially VR to kind of walk them through those scary procedures where they're not sure what's going to happen. It's not exactly the same, but it can give them a level of comfort saying, oh, that's not as scary as I thought it would be. VR has so much potential in education that it's one that you just can't ignore. Another big thing I think that we can really use to promote and overcome this resistance is developing goals that we already have, such as glucose monitoring, making it regular. Develop it into, with the interface for this education part and the post-surgical care, achievements. Build it almost like a game. Develop to promote continued use so that they see, I'm getting better. I can see progress. Incorporate game or competition. Not that they see who they're competing against, but they can look at potentially as a general goal, oh, I'm doing better than half of the people on the platform monitoring my glucose. I'm seeing what I need to do. I'm seeing that I'm doing really well. Also, along those lines, we can incorporate potentially a rewards type system where our device monitoring partnerships, maybe they can offer discounts for devices as rewards for using the interface so that they're getting the education, they're getting the knowledge they need, and they're getting rewarded for continuing to use and get that information. So some of the takeaways that I think we really need to really focus on why this is important, incorporating all this. AI, VR, and IoT can and will improve our patient outcomes. We're not replacing, we're only enhancing the care the patient receives. We're going to keep all of our traditional communication methods. They're still going to be able to pick up a phone and call someone if that's their comfort level. But we want to really encourage and show them that by embracing this technology, they're going to be able to get a better patient outcome. They're going to have a better experience. They're going to get the information that they need in a timely fashion. Thank you for your time today.